Well, hello everyone. My name's Marie Rafferty. I'm President of the Royal College of Nursing, and I'm also Professor of Nursing Policy at King's College London. And I'm absolutely thrilled to be contributing to this online platform and the associated resources that will be curated for that platform. The arts and health is something that I feel very passionately about. And I'm also aware that there's been a growing evidence base developing in this area, fostered by the All-Party Parliamentary Group on Arts and Health, and even some really stunning research recently published by Daisy Fancourt and her colleagues in the BMJ, British Medical Journal, recently, which actually identified that arts interventions can even save lives. Exposure to the arts actually was associated with lower mortality rates in patients and cohorts of people, as well as those who are participating in the arts. So I think there's a growing excitement around this area, and certainly it's something that's got a long-standing history and tradition in healthcare. It's not something that's just popped up very spontaneously or recently. And if we look at the history, because I'm also a historian, this is my particular take on this, even the history of surgery in the 19th century, part of the therapeutic impact that surgeons were trying to project was this sense of confidence in their skill and their expertise. Confidence expressed through speed, but also confidence in their own performance of that surgery, their style of practice. And just to continue this theme of confidence and performance, it's also quite interesting historically that the reform of the old style nurse was thought to be necessary because she had, and it was a she was perceived as having the power to actually undermine confidence in the doctor, the physician, by whisperings in the sick room. Really, the sick room was the space in which the nurse was the preeminent actor, and that really was her stage, and she had a huge influence over the family and, of course, the patient and their capacity to recover, but also to influence the reputation of the doctor. And that's why the reform of nursing itself in its mid-19th century onwards was very much about reforming the character of the nurse and trying to make her less recalcitrant and much more obedient to medical authority and less undermining of it. And of course that was also reflected in the dress, the costume of the nurse, moving from the rather shambolic clothes that we associate with Sarah Gamp, the caricature of the 19th century nurse, to the pristine cleanliness of the 19th century nurse, who was the emblematic of the new sanitary science that was developing from the 1870s onwards under the influence of Florence Nightingale, Joseph Lister, and others. So this whole kind of a sense of performance and care have been joined at the hip, if you like, from very early stage in history, and the theatricality, the drama of healthcare lend themselves exquisitely to that type of analysis. We are living in very, very difficult, unpredictable times, and when performance by governments with the COVID-19 crisis and pandemic is absolutely at a premium. We've seen a lot of commentary on how important and vital it is for government to be projecting again the sense of clarity in its messaging, of consistency in its messaging, and of confidence that it knows has a plan and indeed can reassure the public, because of course one of the the side effects of a pandemic is a panic-demic, if you like. So I think never has the whole, I think, response to care been more potent and demanding of us, not just as practitioners, but also as patients and loved ones and families. This building the sense of resilience, the sense of solidarity, the sense of strength in our own community, this social capital, if you like, often which is mediated by through the arts. This is one of the routes into helping people develop more functional kinds of coping mechanisms. And within higher education institutes and you know, healthcare institutions, the healthcare elements of that, medical schools, nursing, midwifery schools, where HPs and pharmacists and others are trained, I think we see a growing interest in looking towards the arts and this kind of reciprocity that seems to be developing between the interventions as they present themselves for patients, but also the therapeutic benefit and dividend, if you like, of that participation for practitioners themselves. And of course, at this time of crisis, what could be more appropriate than actually to think of ways in which the arts might actually help us to cope with the huge uncertainty that we're actually confronting as a population, but also, you know, as individuals, as patients, and in our family and friends units up and down the land. So I can't possibly see that there's a more important time to be discussing this topic